Good morning. This is Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness. Happy Friday. So today I want to talk a little bit about why women who are undergoing intrauterine inseminations and repeated IVFs either don't succeed in getting pregnant or in fact do get pregnant but chronically miscarry. So there are many potential reasons for this, which I'll get into in a few minutes. But let's talk about IUIs and IVFs from a technical perspective first. So with intrauterine insemination, medication is given to the patient to develop follicles. Once the follicles are mature, the patient is given a shot of Avidril. It's an LH mimic. It'll make the patient ovulate, and then sperm is injected into the uterus in the hope that the sperm will penetrate an egg, form an embryo, and implant in the endometrium. In vitro fertilization, a woman is given gonadotropins, which are hormones to help stimulate the development of follicles. Once those follicles reach 18 to 22 millimeters, they're retrieved, fertilized with sperm. An embryo hopefully is created and transferred into the uterus. These are both mechanical events. You give a patient medicine, you make her develop follicles, you get an egg, fertilize it, transfer it, and hope for the best. So why doesn't it work? So first of all, let me stop and say that it does work very, very often. But it also doesn't work very, very often. So why doesn't it work? Well, there's a multitude of reasons. It could be implantation failure due to poor quality of the endometrial lining. Poor quality doesn't necessarily mean thin lining. The morphology of the lining is not analogous to intra-endometrial vascularization. So in English, that means that even if the woman has a 10 millimeter lining, it doesn't mean that there's enough blood flow in the lining. It doesn't mean that the lining is healthy. What about the husband? He does the semen analysis and everything is fine. And she's fine. And she's 32 years old and he's 33 years old. And they just can't get pregnant. So there's a possibility that the husband has an undiagnosed cause of infertility, which is rendering the couple infertile. The cause could be sperm DNA fragmentation. Going back to the endometrium, what could affect the lining? Endometriosis. People know that endometriosis, of course, is ectopic deposition of endometrial cells. That is to say, cells from the uterus implant in different parts of the body other than the uterus. But endometriosis is a pro-inflammatory cytokine disease where inflammatory proteins find their way into the uterine cavity, cause an inflamed state, and render the environment hostile. Also, endometriosis negatively impacts the endometrial lining itself. What about a patient who has irregular periods, elevated insulin levels, and elevated androgen levels, but has 0 cysts on her ovaries? Does she have polycystic ovarian syndrome? Yes, she does. She has what's called biologic PCOS. What about the patient who gets pregnant, but the size of the developing fetus is not growing normally? It's small for its gestational age. Why is that happening? Perhaps there's not enough blood flow going to the placenta. This causes intrauterine fetal demise or intrauterine growth retardation. What about the patient who's fine but she keeps miscarrying or doesn't get pregnant. And there's no apparent reason. Maybe she has activated natural killer cells attacking the embryos. What about the patient who chronically miscarries in the second or third trimester or has a history of stillbirths? Perhaps she has a thrombophilic disorder, a blood clotting disorder, which causes these things. So there is a lot more to getting pregnant and staying pregnant than just the mechanical contributions of assisted reproductive technology. And this is where acupuncture and herbal medicine come into play. Acupuncture and herbal medicine can help improve the quality of the lining, can help improve the quality of the eggs, and can help improve the quality of the sperm. So when these factors are in fact improved, the patient has a greater chance of getting pregnant naturally, or certainly has a greater chance of getting pregnant with assisted reproductive technological intervention, IUIs or IVFs. So, in my opinion, based on 22 years of clinical experience as an acupuncturist and an herbalist specializing in the treatment of infertility, it behooves the patient who is having a difficult time conceiving or who is having chronic miscarriages to utilize acupuncture and herbal medicine as part of your journey to family. Acupuncture and herbal medicine have been used efficaciously for 3,000 years to treat infertility. IVF has been around since the late 1970s, I believe, or the early 1980s. And so I think that by combining East meets West in reproductive medicine, we can kind of create a new paradigm of healthcare for those faced with fertility challenges. I highly recommend that you consider my words of advice. I think you'll be pleased in the end if you do. If you'd like to ask me any questions, you can feel free to call me at 212-685-0985. And to find out more about what we do and how we can help you on your journey to family, feel free to visit our website, which is www.berkleycenter.com. That's BERKLEY center.com. I want to wish all of you a great weekend. Blessings. Godspeed on your journey to family. And once again, thank you so much for watching. Until next time, bye.